There is one specific visual pattern that, if you have noticed it in the toilet over the past several weeks and dismissed it, might be the most critical detail I share with you today. It produces no pain, no bleeding, no fever, or any classic warning sign. It simply shows up quietly, morning after morning. Most people assume it is related to something they ate and move on. Some are right, some are not. I am Dr. Mandell, and I have spent years in medical practice, with much of that time focused on older adults. Throughout my career, I have sat with countless patients who came for routine checkups and casually mentioned they had noticed something unusual in the bathroom but weren't sure if it mattered, and I had to tell them clearly it absolutely did matter. In fact, it was exactly what they should have mentioned much sooner. Not to frighten them, but because that was the honest truth. Here is what I have learned. Your digestive system produces a daily physical record of what is happening inside your body. Color, consistency, and shape all carry specific information, some so unique that a trained physician can use it to identify a condition before any other symptom appears. The real problem is that almost no one has been taught how to read this record. It rarely comes up in appointments. There isn't enough time, or it feels awkward, or doctors assume patients already know the basics. So decades pass, and people flush away this daily record without a second glance, not because they are careless, but because no one ever told them to pay attention. That changes today. Over the next few minutes, I will explain what your body may be trying to tell you. We will cover what normal looks like, what common changes mean, which colors require urgent attention and which do not, and which stool shapes, when persistent, should send you to your doctor immediately. Stay until the end, because the most important sign, the one most often missed, comes later and can change everything. I am Dr. Mandell. One question has guided much of my clinical thinking. What is the body already trying to tell us? Not the dramatic symptoms that send people to the ER, those get attention on their own. I mean the subtle signs that appear weeks or months before anyone notices. If this is your first time here, please subscribe. I post weekly content because important health topics deserve more than a quick summary. This is certainly one of them. Before we discuss what is abnormal, we need a clear picture of normal. You cannot recognize a problem if no one ever defined the baseline. Most people simply don't have one. On most days, you should see stool that looks like a sausage or a smooth, gently curved log, soft but formed, not watery, not crumbly, not hard and compacted. It should pass without straining, discomfort, or that lingering feeling of incomplete evacuation. And it should be brown. That brown color is not random. It has a specific biological cause. Your liver produces bile, stored in the gallbladder and released into the small intestine when you eat fat. Bile breaks down fat so it can be absorbed. Interestingly, bile starts out green, a distinct noticeable green, but bile travels through the entire digestive tract, interacting with bacteria and enzymes along the way. When everything works as designed, proper transit time, healthy bacteria, no acceleration or slowdown, the final result is brown. That is the color we instantly recognize. It tells us the digestive system has done its job. Soft, formed, brown, passed without straining. That is your baseline. Hold that image in mind. Everything else is a departure from it. The first thing people notice is consistency. Too hard or too loose. Hard, dry stool that breaks into small pellets, like pebbles, usually means it stayed in the colon too long. The colon absorbs water, and when transit slows, it keeps extracting moisture. What was soft becomes dry and difficult to pass. That is constipation. But that word doesn't fully capture what is happening. Constipation can come from dehydration, more common after 60, and often underestimated because thirst becomes less reliable with age. Low fiber, certain medications, blood pressure drugs, pain relievers, iron supplements, or diverticular disease can also contribute. Hard stool is not just uncomfortable, Repeated straining increases pressure, worsens hemorrhoids, weakens pelvic floor muscles, and can cause tears that make future bowel movements even harder. It becomes a vicious cycle. At the other end is diarrhea. And here I want to be very precise. There are two types: loose stool for a day or two after a heavy meal, antibiotics, a virus, or food that didn't agree with you is usually temporary. The body handles these disturbances well. Rest, hydration, and time are often enough. But diarrhea lasting more than 4 weeks is different. Now the body is not adjusting, it is failing to return to baseline. Causes range from chronic inflammation to parasitic infections to tumors irritating the intestinal lining. None of these resolve with time. If loose stool has been part of your daily life for a month, the answer is not a probiotic. It is a physician who can find out why your system hasn't recovered. Color is where the digestive system leaves some of its most revealing clues and where most people have no framework. Green stool often worries people but usually shouldn't. Leafy greens like spinach, kale, or broccoli can cause it. Or food may have moved through too quickly for bile to turn brown. On its own, this is rarely dangerous. But if it persists without a dietary reason, mention it to your doctor. Pale stool, clay-colored, yellowish, or chalky is much more significant. When stool lacks brown, it usually means bile either didn't reach the intestine in enough quantity or wasn't produced properly. Brown comes from bile. If bile is missing, the stool shows it. Causes include bile duct blockage, liver dysfunction, pancreas disorders, or giardia infection. None of these will resolve on their own. None should be dismissed as dietary. Sometimes pale stool is also greasy or oily steatorrhea. This means fat is not being absorbed. It may be due to low pancreatic enzymes, insufficient bile, or intestinal lining disease. It's not dramatic, but it deserves a full workup. Two colors should overcome any hesitation about seeking help. First, black stool, not dark brown, but black like tar, sometimes thick and sticky with an unusually strong odor. This is often digested blood. When bleeding occurs in the upper digestive tract, esophagus, stomach, or first part of the small intestine, the blood travels all the way through. By the time it exits, it has been transformed into something dark and unmistakable. Causes include bleeding ulcers, severe gastritis, or esophageal varices. These are emergencies. This is not for home monitoring. Iron supplements can darken stool, but do not create the tar-like appearance and odor I just described. If your stool is truly black and tarry, seek evaluation the same day. Second, bright red blood, visible in the bowl, coating stool, or on the paper. This usually comes from the lower tract, sigmoid colon, rectum, or anal area. The blood hasn't traveled far, so it stays red. Hemorrhoids are a common and usually benign cause, and I want to be fair, they affect many older adults. Most of the time, red blood is from hemorrhoids. But here is the direct truth. Hemorrhoids are also the diagnosis people assume without evaluation. Polyps bleed, colorectal cancer bleeds, and one reason both go undetected is that people see red blood, remember past hemorrhoids, and categorize it as familiar. I have seen this pattern too often. Visible red blood should be evaluated by someone who can actually identify the source, not by guesswork. Now let me discuss what I consider the single most important point in today's conversation. Not color, not consistency, but shape. Specifically, stool that is persistently thin, narrow, or flattened. Some describe it as ribbon-like, pencil-thin, or like a crayon. I mean stool that has changed in width from what was always normal for you, and that change has persisted. Not once, not one unusual morning, but consistently, day after day, week after week. This is the sign I see missed most often. Not because people don't notice it. Many do. The problem is they don't know what to make of it. It isn't dramatic. It usually doesn't hurt or bleed, so it gets quietly dismissed. I need you to understand some anatomy. The colon is a hollow tube, about 5 feet long. Its normal diameter is wide enough for stool to pass in a full, rounded shape. Like any tube, its shape affects what passes through it. When something changes that interior, pressure from outside, growth in the wall, or narrowing of the space, whatever passes through becomes narrower too. Persistent pencil-thin stool is your body telling you that something may have altered that passageway. There are benign explanations: chronic anal fissure, diverticular disease, or external pressure. But persistent thin stool is also one of the recognized early warning signs of colorectal cancer. I use the word early deliberately. This change in shape often appears before pain, before weight loss, before many of the symptoms people associate with serious illness. That means your body may be giving this warning while treatment is still highly effective. If you have noticed this change, if the width of your stool has changed and stayed different, please let a physician determine the cause, not a search engine, not your own guess. These signs rarely appear alone. The body sends messages in clusters. With a structural change in the colon, you may notice a persistent urge to have a bowel movement even when little or nothing passes, a feeling of pressure, of incomplete emptying. Clinically, this is called tenesmus. It can feel like constipation, but unlike ordinary constipation, it does not improve with more fiber, water, or exercise. The feeling keeps returning because it is caused by a physical presence in the rectum or lower colon. You may also experience a different kind of fatigue, not the kind that improves with sleep, but a heavier, settled fatigue that has no obvious explanation and won't lift. This can be from slow blood loss over weeks, leading to anemia. You may also look pale. People close to you may comment that you seem less vibrant or not yourself. Abdominal discomfort that repeatedly returns to the same spot, a dull ache in the same place, also deserves attention. An unexplained weight loss, not a few pounds from eating less, but a gradual, unintended reduction that no one can explain. None of these symptoms alone makes a diagnosis. Each can come from many conditions, most less serious than the diseases we've discussed. But when several occur together, especially with persistent changes in stool shape, bleeding, or both, they deserve prompt medical attention. The body rarely sends every warning at once. More often, it accumulates them quietly, one signal at a time, waiting to see if you are paying attention. Let me be very specific about when I want you to stop waiting. Black tarry stool, even once, is not for watching a day or two. It warrants a same-day call or ER visit. Bright red blood you cannot confidently attribute to an active confirmed hemorrhoid also needs evaluation. Even with past hemorrhoids, if the bleeding is new, heavier, or different, don't assume, get it examined. Stool that has been consistently narrow or ribbon-like for more than 2 or 3 weeks, especially with other symptoms, also deserves evaluation. 2 or 3 weeks is not long. If it has lasted that long, it has earned a conversation with your doctor. For any of these, the right next step is a physician who can refer you to a gastroenterologist or colorectal specialist. In many cases, a colonoscopy will be part of that workup. I have watched people postpone colonoscopies for years because of discomfort. Unfortunately, by the time some finally agreed, the conversation had changed. A colonoscopy lets the doctor see directly inside the colon, not infer, not guess, actually see. And when a polyp is found, which is common over 60, it can often be removed during the procedure. A polyp removed before it becomes cancer is not a cancer story. It is a prevention story. One happens because someone investigated when the signs said to. After 60, a colonoscopy is usually far less frightening than its reputation. The preparation is inconvenient, but the procedure itself is done under sedation, and most patients remember little. What it gives back is real, direct information about what is happening inside you. When the signs we discussed are present, that information is not optional. Waiting until you feel more certain is precisely how certainty becomes harder to obtain. Before I finish, I want to connect one last idea. Earlier, we discussed pale stool and explained that normal brown color comes from bile produced by the liver. When the liver is under stress, when it has accumulated damage or excess fat over years, bile production and flow may change. And when bile changes, stool often changes with it. The pale stool we discussed is often a downstream reflection of what may be happening upstream in the liver. In a previous video, I talked about fatty liver disease, what accumulates over decades, and about certain bitter plant compounds studied for their potential to support liver function. If today's talk about pale stool, bile flow, or the liver's role caught your attention, that video belongs alongside this one. The link is below, and I want to leave you with one final thought. Every single day, your bathroom gives you a physical record of what has been happening inside your body. Most days, that record will reassure you that your system is doing exactly what it should. Most of the time, you will see what you expect, flush, and move on. But on the days when something is different, a new color, a changed shape that stays changed, blood where there was none, you now have a framework for understanding what you are looking at. You know which signs deserve attention. You know which should not be ignored. And you understand the difference between a body that is simply adjusting and a body that is asking for your attention. Your body has been leaving you these records for years. Today, you learned how to read them. I'm Dr. Mandell. I'll see you in the next video.